So we're going to do a glucose check, and in order to do that, we want to make sure that we've got all our stuff ready, because it's not a super fast procedure, but it does move fairly quickly, especially once you've pricked the finger. So I'm going to prep by tearing open a 2x2. That's going to come in handy. We need an alcohol prep, a Band-Aid, and a trick that I do. It's probably frowned upon because it's not as aseptic as it should be, is take it and kind of stick it to something so that's handy. I've seen some people stick it like to their glove, so it's like right there available. Glucometer, dextro sticks, and some form of finger stick if you're going to do a finger stick glucose. You can also do a glucose off of the back of an IV catheter. If you get a good blood return on it, you can do your glucose that way. Each glucose monitor or tester is going to be different, so you follow manufacturer's recommendations on how to use that particular glucometer. So this is always fun too, by the way, trying to get this out. If you're beating and banging down the road, when you get all those, you end up dumping a bunch of them. This is where the money is, by the way. The glucometers are not that expensive, but these strips are crazy expensive. So we're going to get our strip out. And this particular monitor, we put the strip in first, which activates the glucometer. We're going to tear our alcohol prep. And I usually ask the patient, do you have a finger preference that you would rather me stick?
This one's fine.
The middle one? Okay. So I'm going to prep the entire finger. Okay. And same thing with trying to remain as aseptic as possible. They advise not to fan it or blow on it or anything like that. So you just allow it to dry. And in this particular lancet is, this is fairly common. I've seen some others that have got like a push button on them that work. But this one, you just apply it to the patient's finger and then push down and it'll pop and lance their finger. So if their fingers, especially if they're not, if they're pale, or they're cold, you may need to like rub the finger to try and, I call it milk the finger. Get it nice and red so there's plenty of blood in there. When you lance, you want to lance the side of the finger, not directly on the tip. It's less painful there. So I'm going to come in from here and lance that side. Okay, going to be a stick. 1, 2, 3. Okay, this is where your 2x2 comes in. Take that first drop of blood, wipe it, and then get your second glucometer, glucose strip. Once that's done, I'm ready to take the Band-Aid, stick it on. Her glucose is 145. You can see it right there. And the Band-Aid on. And that way I can go on about doing my business, do whatever else I need to do. Remember, your sharps goes straight into the sharps container. This one's fairly safe from here, but you still straight into the sharps container after you've done the stick. And then it's always nice to clean up your mess in the back of the truck, unless you really don't like your partner and want to leave them a mess. Turnabout's fair play though.